Medical informed consent is this idea that a doctor or a midwife is sitting down with you and making you aware of what your choices and options are. And if there is a real medical reason to intervene, they are giving you that option. For example, I see this a lot in hospital settings. A nurse might come in and say, oh, your doctor called and said, that you're not making the kind of progress that we would like to see you make right now. So we're going to go ahead and start Pitocin now. That is not informed consent. Informed consent would be, hey, how are you feeling? We've kind of noticed that your labor has sort of slowed down a bit, and I know you're super exhausted, so we had this idea maybe that we would offer you Pitocin. How do you feel about that? Would you like some privacy to discuss this with your birth team? If that doesn't happen and someone is coming in the room and asserting themselves and saying, well, this needs to happen right now, first of all, there are very few situations where you have to make a decision on the fly. And when you are in that environment, you leave it up to your provider who you have entrusted to guide you through your experience to make the best decision. But more often than not, you are going to have time and space and privacy. And sometimes that is teaching your partner how to ask for privacy and space. Okay, nurse, I hear what you're saying. Now, can you come back in 5 minutes so that we can discuss this in privacy?